Hi, everyone. I'm Dr. Gary Smith at the Toledo Family Wellness Center. Today, I wish to talk to you about the number one food causing leaky gut and many of the other intestinal diseases, um, namely gluten. Gluten is actually composed of a few proteins. Gluten is strictly is repeat. Gluten is a sticky protein found in grains and is added to many processed foods today. Besides gluten, there are other foods with very similar proteins that also cause reactions. So if you remove gluten foods from your diet, you still may miss the others. That is why you need someone who thoroughly understands the gluten group of food sensitivities when testing. And finding the treatments. I'm going to do this over. Um, I'm getting there. Where is it? Number one. Okay. That is why you need to find someone who thoroughly understands the gluten groups of food sensitivities when testing and finding the treatment solutions. Some symptoms of gluten sensitivity are grains, you'll find, make you tired or cause difficulty with focus, make you feel bloated, or better when you don't eat. You simply feel better when you don't eat grains. A person is more likely to have symptoms. Repeat. A person is more likely to have symptoms related to the brain and thyroid than related to the gut. The problem comes from the fact that grains, especially wheat, have been hybridized close to. Just a minute here. I'm going to repeat this. Okay. The problem comes from the fact that grains, especially wheat, have been so hybridized that they're almost GMO, um, but but they're really not. Also, I'm going to repeat that again. The problem comes from the fact that grains, especially wheat, have been so hybridized that they are close to GMO, but not exactly like GMO foods. Also, the grains are uh, D. Repeat. Also, the grains are what's called deanidated. I'm going to repeat that again. Also, the grains are what's called deanidated. When grain, repeat, when people with when gluten sensitivity people are exposed to the native unchanged wheat, they often do not react to the wheat. Grouped into the gluten family is, repeat, grouped into the gluten family is proteins called transglutaminase 2, 3, and 6. Transglutaminase 2, or TG2, is found in the intestinal lining. The immune system may attack the TG2, damaging the intestine when food is absorbed. The TG3 is found in the skin, and TG6 is found in the nerves. If the immune system has tagged TG3 or TG6, it will damage those tissues or tag them for destruction. That would be the skin. That would be the skin and the um, uh, nervous system. Most doctors and their labs do not test for the numerous gluten components and cross reactors. There are cross reactors. Well, we're going to get into that a little bit more. These cross reactors are foods with gluten-like proteins. Going gluten-free may seem difficult at first, but it can be the solution to most of your health issues. The primary sources of gluten are wheat, rye, barley, spelt, kamut, oats, except from a truly gluten-free farm. Foods suspected of cross-reacting as gluten because the immune system recognizes their components as gluten are: number one, milk casein, corn, oats, and some brands of instant coffee. Hidden sources are found in modified cornstarch, food emulsifiers, food stabilizers, artificial food coloring, malt extract, dextrins, um, clarifying agents, in some um, and in some red wines. Commonly overlooked sources of gluten: processed condiments such as ketchup, mustard, salad dressing. Also, transglutaminases are added to many processed meats. The grocery stores add it to meats to make it tender. It is typically found in restaurant meats because they want the meats to be the most tender for their customers. And it's even in chicken these days, but very unlikely to be in fish. The only way to be sure it's transglutaminase free is to buy grass-fed beef from a farmer who can be trusted. There is no such thing as gluten-free unless you are 100% off it. It's cross-reactors if they are among the offending foods. Most people notice feeling much better after a week of truly being gluten-free. A little gluten-free will sabotage your attempt. I'm going to repeat that. A little gluten will sabotage your attempt to calm the immune system so it substantially stops attacking your tissues. What can you do to help yourself if you are exposed to gluten? The number one thing I would do is to take an enzyme supplement called DPP4 to aggressively digest the gluten and casein into harmless amino acids. Number two, take what's called brush border enzymes. These are located in the intestinal lining, and the intestines are used to having them there, and they're helpful for the lining of the intestine. Intestinal damage can destroy the villi and brush border enzyme activity. I do not recommend bromelain and pancreatic enzymes, a variation of enzymes, rather here now. So these bromelain and pancreatic enzymes can cause damage to the villi, especially if you're taking them, if you're taking too many. Okay. Those enzymes, okay, I'm going to do that over. I do not recommend bromelain and pancreatic enzymes because if you have the leaky gut villi damage, these enzymes, which will be then in higher quantities because you're taking them, can damage the villi, which are the sites of digestion in the intestine. Okay. So you don't want to do that. You can use plant-based enzymes, amylase, cellulase, invertase, and lactase. Those will be fine. Number three thing here. Flavonoids help dampen the gut inflammation. Use a dosage that seems to help you. Try to get a supplement with as many of these available: lycopene, agigenin, that's Agigenin, quercetin, and luteolin. Well, I hope that helps. The next video is on other, repeat. Well, I hope that helps. The next video is on other food sensitivities and allergies. Until we meet again, take care. Okay, Dan.
How was that?
I don't know, a little jerky, but That's okay.
Yep. Repetitions.
It's acceptable.
Practice makes perfect.
Yeah. And also I gotta just read them over a few times before I do it.
The thing is, what happens, Doc, is that
you're so good
as long as you,